7:17, and in this morning's medical alert, when it comes to breast implants, the FDA is now saying that 1 out of every 5 women will have to have their implants removed or replaced every 10 years. Well, Dr. Michael Cohen of the Cosmetic Surgery Center of Maryland joins us to elaborate more on what this means for women with breast implants. Thanks for coming in.
You're very welcome.
All right, how do you interpret this report?
Well, it's information that we're already aware of. The study says 1 out of every 5 may need their implants replaced, but really that leaves 80% of women that will not need anything done even at 10 years. So it's really could be looked at in a positive way.
Well, why are they saying that they will need to have it redone?
Well, there are various different reasons why people might need to have them removed. Some of them are purely elective. A woman's body changes with pregnancy and with age. There are reasons why women might want to go bigger, might maybe want to go smaller, may want to have them changed for silicone if they already have saline. So there's a lot of reasons why somebody might need a reoperation, but some of them are purely elective.
Okay, and they also said, or 1 in 2 for patients for implants that would happen as a result of reconstruction.
Right. Reconstructive patients typically have greater needs for replacement with because of conditions of scarring and other needs, but that's a little bit of a different story versus elective or cosmetic indications.
Right. Okay, so you gave us some of the reasons, but I guess for the person who's sitting at home saying, okay, I got these, I expected them to last for life, what medical reasons would I need to get them?
Right. Well, we always tell patients when we interview them that these are not intended to be lifetime devices, although many of them, and I've been in practice for close to 20 years now, only about 5% really actually need their implants replaced. So there's a great chance that they're not going to need anything done, and at about 10 years we may want to consider doing some special studies. Women should be checking themselves all the time for any changes. Any change, they should note that to their physicians.
Are there any health risks to you keeping the implants in for more than 10 years?
No, absolutely not. The FDA has said this repeatedly, and again, as plastic surgeons, we agree that there is no additional health risk for having breast implants.
Okay, let's talk about the different kinds, because certainly, you know, they've come under scrutiny over the years, especially, let's start with silicone, and that was an issue for many years, but now you have a new, safer type. Right.
Since 2006, the new generation silicone implant's been approved by the FDA. It's a better implant. It's made of a cohesive gel. It's very soft, feels very, very natural compared to the saline device, which was the substitute for many, many years.
Okay, and so, and then the saline implant, the difference there is that they're filled with salt water.
Correct. You fill it up. They can be adjusted prior to finishing the operation, and there's small little bit of adjustment. Silicone implants come in specific sizes, so you have to make a decision before surgery or even during surgery what size to use.
Okay, and the advantages or disadvantages to each one? I mean,
the saline implants over time can ripple a little bit and feel a little bit baggy. If a patient's very, very thin, they might be able to perceive some differences. The silicone implant does feel very natural, and patients seem to love it. In fact, we're getting a lot of patients that come in that want their saline implants replaced for silicone.
Okay, so people can get more information by going to your website. Thank you so much for coming.
You're very welcome. My pleasure.
And that website is www.cscmd.com. And don't go away. When we come back, do you have a wedding to attend?